Hello, welcome to Primetime Live with Next Level Prime. This series is meant to let listeners hear about all things Next Level Prime. I'm your host, Dr. Karen Rakers, Vice President of Next Level Prime. I'm a family medicine physician, and I have been with Next Level for almost 10 years. I'm thrilled to have been involved in our Next Level Prime program since it launched over 3 years ago. So as a reminder for our listeners, Prime is an advanced primary care model. We contract with employers, which allows employees and their dependents to have access to unlimited healthcare services at Next Level 7 days a week. We have a virtual care platform combined with a large network of physical locations in the Houston, San Antonio, Austin, and Beaumont areas. And the care provided includes primary care, preventive care, chronic disease management, urgent care, health coaching, and emotional wellness counseling. We also include a team of nurse care navigators to help patients with their healthcare journey, as well as managing any referrals that might be needed. In addition, most common labs and routine vaccinations are included in the program. And the best part is that all of this care is provided at no cost to the patient. So no copays, no deductibles, and no surprise bills. We are trying to break down the barriers to care, including cost and convenient access. So today I have Art Getz, the CEO of Scoop Health, on the program with me. And the focus of today's discussion is how to take back control of your healthcare budget, which is timely after the Houston Business Journal's March 15th cover story titled Sticker Shock, Houston Employers Are on the Search for a Magic Cure as the Cost of Healthcare Continues to Rise, mentions Scoop Health and what Art and his team are working towards. So thank you so much for joining me today, Art, and we will jump right in. I would love to have you tell me about how your background in business and healthcare kind of have influenced your strategies to help companies replace their group health insurance.
Well, great. I'd love to tell you about that because it's really interesting how I kind of had this wandering career that all of a sudden became perfectly clear to me when ICHRA came out. And you'll see how that all kind of comes full circle. But, my most notable accomplishment is I was a roll-up guy. We bought a bunch of companies. Me and a couple of other people got together in a kitchen. And 4 years later, we had 36,000 employees. We bought a lot of companies. We bought companies from 25 employees to 2,500 employees, but we were paying for earnings. We were buying these companies and paying 5 to 7 times earnings sometimes. And so we were buying service companies. These were mechanical contracting businesses, air conditioning, plumbing, electrical, voice and data cabling. These employees, we stuck them in a truck with $250,000 worth of inventory and a customer list. And they would go call on our customers and they would service their stuff. And we just pray they did a good job and made their customers happy. But the one thing that we knew after we bought these companies, we couldn't afford to lose those employees. They were like our lifeline. That was our revenue. And so, when we showed up after closing to meet those employees the first time, you could hear a pin drop in the room. Everybody was on the edge of their seat wondering what the heck were we going to do better or different than the guy we just bought the business from, who they knew and loved. So we started out with a PEO. It was a company called Amidst at the time. Today it's called Insperity. But we were buying companies so fast. Our first closing, we bought 12 companies at the same time. And so
Wow.
Insperity or Amidst gave us the ability to onboard those companies quickly, and they had a master health insurance policy. It was all super expensive, but it worked really good for a company that was buying other businesses really fast because we didn't have an HR department.
Yep.
And then after about a year of that, we stood up our own HR department and we went through the whole fully funded insurance route. Then we did level self-funded. Then we formed our own captive. So I have walked the walk of every employer who's tried to figure out how to balance between earnings and profits and the health of my employees and my business, because I count on those people every day to show up, especially if they're doing some sort of repetitive work. I count on being in the truck because I've scheduled 12 service calls that day. They better be happy and healthy when they're going on those calls. So I understand this like 200 times over. So after we did our initial public offering, I left that business after about 4 years and a lot of hard work, meeting a lot of employers and companies. And a neighbor of mine was an ER doctor, and he said, "Oh, we have this problem in emergency medicine. Wait times are really long. Help me
Yep.
start. We can solve this problem." He said, "If we could just build non-hospital based emergency rooms." And so I was sitting there with nothing to do and maybe a little bit too much money in my bank account. And so I said, "Sure, let's do that." And the next thing
Yep.
you know, I was in Boston passing a law licensing freestanding emergency rooms. But I gained this incredible insight into healthcare, being the
Yep.
operating guy, watching how emergency rooms work. And you know who came in the door every day? Employees with insurance cards.
Yeah.
They used to be employees. And so I was looking at this through this incredible lens of, oh my gosh, these people are coming in here. And I'm a business guy, so I try and think of things and unpack things in a different way. But these people all showed up wanting the same thing. They all needed, I call it the white coat. They all
Yeah.
needed somebody in a white coat to sort of back them up and say, what you think is wrong, or no, that's not it. Maybe it's this. So matching up their symptoms with a roadmap. Here's what to do next, and here's how we're going to get you better. So in healthcare, all of healthcare, what happened was Blue Cross kicked out the customer because customers do price and customers do quality. And when Blue Cross came along, they said, don't worry about any of that. If they take this card, they're a good doctor. And if they
Yep.
take this card, you don't have to worry about the price because we got it.
Yep.
And that was wonderful until all of a sudden, Blue Cross, Aetna, Humana, all of them within about a really short amount of time, 30 days or so, stopped paying the bills. They stopped paying the emergency room bills. This is 4 months after they'd gotten their care. They were probably back on, going through life and doing whatever. And here comes the letter from your insurance company that says your emergency room visit was denied, and now you owe the emergency room $5,000, $6,000, $10,000, whatever the number was. And so I had to call those people, and I had to listen to them cry and their pain and what they were going through, because they thought they had an insurance card.
Yep.
And it broke my heart to see what insurance did to these people, because profits mattered more than their care. And they didn't know. How would they know whether it was an emergency room? It turns out that about 85% of the people that came to the emergency room, they weren't emergencies at all. You know what they really needed? They needed next level prime. They needed somebody that they could turn to and get that roadmap, get that triage, get those symptoms mapped to a diagnosis, and get them on the path to wellness. And the problem is that fee-for-service healthcare was in the way, and insurance paying for it was in the way. It blew my mind to see how it worked. The employee shows up, gets the care. The provider sends a bill to the insurance company, who marks it up and then gives it back to the employer as a premium, and everybody's happy with that. It's awful. So I learned in the ER that healthcare is an individual sport. We all show up with different predispositions about what's good, what's bad. Some people are rub some dirt on it. Other people are like, they want a doctor to touch them and talk to them and console them. And you know what I learned is that neither of those is bad, because it's just the way we consume healthcare, and healthcare should conform to us as individuals. It shouldn't be this one-size-fits-all brick called group health insurance, and if you fit in that box, great. Oh, by the way, there's a $5,000 deductible before you get anything. So we disenfranchise the 85% of healthy people to take care of the 15% of sick people. So that whole ER experience, we experimented with membership-based primary care in the ER, but I left the ER and I started my own membership-based primary care practice. You know what I'm talking about, Dr. Rakers. It's First Primary Care, and it was great. It worked really good, but there was just something missing. It was just something missing from that. We didn't have good labs. We didn't have urgent care. You could get a phone call after hours, maybe, and it was okay. It was great if you were one of those frequent flyers that really needed to be on your membership-based doctor's list, his phone list and stuff. But then I stumbled into Next Level Prime, and Dr. Breeze and we've been friends a long time, and I'm just blown away what happens when you add those other pieces to this. I say, look, 100% of us need primary, preventative, and urgent care every year. 100% of us. Why the heck would we give that to an insurance company so they could mark it up and then give it back to us as a premium? Why not get fee for service out of the way by putting a subscription in place and pay for that on a monthly basis, because you're going to use it? My gosh, it's brilliant. And so when I saw that, it just kind of blew my mind. And that is where I am today, because ICHRA happened.
ICHRA happened.
ICHRA happened.
Yeah. So you've already brought up so many of the major issues that, surround this whole healthcare debacle that we have going on now. I mean, health insurance is super confusing. You kind of touched on that. You touched on the patient not being able to be a consumer of healthcare, also a big problem. I love that you talked about employees being the most valuable asset. I think that's a big, thing that employers are worried about and concerned about, not wanting to lose their people and how to keep them. And then I love that you talk about how primary care is very important to the whole healthcare structure. So I love all of that. I know you have a lot to say about ICHRA. So let's actually talk about, a lot of people might not know what ICHRA is. So tell us about what is ICHRA and why is it being called the 401k of group health benefits?
Oh, come on. You've never heard of ICHRA. I can't believe it.
Not me.
So, it's the best kept secret in the world. It pains me that it's so well kept as a secret, because it's like, it used to be when you went to buy a car, it always came with an internal combustion engine. And then about 20 years ago, we all got a choice. And now I can pick electric or gas. And so then I have to think about my lifestyle. And would it be better for me to have an electric or gas? And I think about my consumption patterns. Well, this is exactly the same as group health insurance and ICHRA. There was nothing but group health insurance until ICHRA came along. It came along on 1/1/2020. Guess what happened? Do y'all remember? I have people tell me they forget already how fast we forget. 3/1/2020, what happened? 2 weeks to the flat line, right? And then all of a sudden it was 2 years. We went into a COVID lockdown and ICHRA went into the dark. ICHRA replaces group health insurance. Let me just get it out there. We have a choice now. This is a gift to every employer. It is yours to decide if you want to drive electric or hydrocarbon engine. You have to make a choice. If you decide that you're not a candidate for ICHRA before you look at it, shame on you, because it might work. And it's not something that your insurance broker is going to be able to help you with, because it knocks off the insurance piece. So there's nothing against insurance. Insurance is definitely a solution for some businesses. ICHRA is a solution for others. And we'll get into more about that. I'll tell you more about who I think it is. But the federal government changed the ACA rules. Mm-hmm. And they gave us this. So the why they can make the 401k comparison is super important. When employers used to have employer-based pension funds, and those pension funds, the employers actually made the investment decisions. And you can only imagine, I was going to say what kind of a show that was, but it was terrible. Employers were getting all kinds of flack from employees that didn't like the investment choices. Oops, I lost your money, or I invested in a condo project in Galveston. All that is to say, it was a mess. And employees started suing employers under the ERISA laws. Well, that's great, and they won, and we got 401k as a result. The federal government created 401k, and we all know how it works. The employer puts in the pre-tax dollars. The employees get to make their own choices. And ICHRA was created to absolve the exact same problem that's starting to occur with group health insurance. We all just saw what happened with the No Surprises Act, and Johnson & Johnson is the first big employer to get sued under ERISA because they made choices on the employee health insurance plan that the employees disagreed with. This is the canary in the coal mine. These lawsuits are coming, and more employers are going to experience these lawsuits under ERISA because employees don't like group health insurance. We give it to 100% of our employees, and 85% of them think it's garbage because they never get to use it. So ICHRA comes along and says, let's do this a different way. So this was the Department of Labor, Health and Human Services, and the IRS. And they all rewrote the ACA rules, and they said that 800,000 businesses will drop group health insurance and move to an ICHRA strategy. But the key word there is strategy, because ICHRA on its own, it's a turd. It just sits there. It does nothing. It's a terrible thing. It doesn't work until you have a strategy. You have to know how to use the ICHRA rules, just like you have to know how to use Rule 401k. You need an advisor to help your employees consume this new solution, just like you need a 401k advisor to help enroll your people in the 401k so they can spend your pre-tax dollars. That is ICHRA at its essence. It eliminates that risk that every employer carries around with group health insurance. So, let's see. That's pretty much the comparison. We can go deeper into the comparison, and it holds up from beginning to end. ICHRA takes away all that group health insurance exposure, just like 401k took away all the pension fund exposure. Nobody has pension funds anymore, and I argue that someday nobody's going to have group health insurance anymore either.
Yeah.
So
I think it's
not too
interesting
big of an order, huh?
Yeah, well, no, I think the employer acting as a fiduciary when it comes to those funds that are going into the group health plan is going to be definitely a big issue. That Johnson & Johnson suit that just happened is going to kind of pave the way for probably, I agree, a lot more of that coming down the road.
Oh, sure. Yeah, lawyers are good at that.
Well, tell us, I guess. Yeah, they're going to figure out a way to capitalize on that for sure. So, I'm guessing that brings us, to Scoop Health. So tell us about your work at Scoop Health and, what you got going on over there.
Yeah, so, we started Scoop Health because I saw I was involved in legislating freestanding ER. I wrote that law in Texas, and so I really have a fascination with the interaction between law and healthcare. And I saw the ICHRA rules coming down. They went live, or not live, but they went public in 2019, and then in 2020, 1/1, ICHRA went live, and I thought, my gosh, that's going to die in the darkness because there's not an insurance broker on the planet that's going to tell his client that you can eliminate me and do something different. You have a choice now, and I'm only 50% of your choices. Yep. That's probably not going to happen, yet the insurance brokers brand themselves as benefit advisors, and they're very trusted people, and rightfully so, because for 60 years they've been solving the problem that employers had, and there was only one solution. And just like pension fund advisors were probably a little jealous of the guys that ran 401ks, I think we're going to have that same dichotomy going on with health benefits. So I started Scoop Health to really understand the ICHRA rules and to create solution sets around ICHRA that matched up with employers' needs. First and foremost is to attract, retain, and reward employees. All those companies that I bought, not every single one of them, it didn't matter whether they were big or small, whether they fixed air conditioners or plumbing, they all felt the same way about profits and people. And every business has this problem. I don't care whether you're in manufacturing or you're a car dealer or whether you're doing some sort of property management or maintenance or facilities maintenance. Even if they're low-wage employees, if they show up on time. I own the Texas Rock Gym. My employees don't make a lot of money, but I darn sure need them to show up and be happy and do their job. And they know uniquely how to do that job. I can't just pluck somebody off the street and plug them in. I count on them to show up, even though I can only afford to pay them $15, $20 an hour. And so I think that's true with every business out there. We've been sort of programmed that group health insurance is the gold standard. And as an advisor for ICHRA, I just show people the contrast between the two. Let's just pick it apart. Let's look at the problem as though health insurance was never invented. Let's just start there and say, we've got all these people, we count on them to make money, they got, and we love them. We love them like family, because the longer they're with us, the more attached we become. And so this is an emotional, toxic stew of profit and employee best interests and my best interests, and it just gets all messy. Because then I go buy group health insurance and I take on all the health risk of all of those people, and then I try and insure against it. What could possibly go wrong? And it's gone wrong in grand fashion. People getting 15, 20% increases per year. You can't run a business that way. I lived through this crisis myself. I've experienced it myself. I saw ICHRA and I thought, oh my God, we can change the world if we do this right. And that's why we have Scoop Help. I love helping employers look at this problem through a new spyglass, a whole new perspective.
Yeah. Yes, I think a big discussion, because again, as we talked about in the beginning, a lot of people don't even really know or understand what an ICHRA is and how it is different from group health insurance. So tell us a little bit about that. Compare, ICHRA, how it works compared to group health insurance, and even maybe a self-funded group health plan that we people are switching over to, those sorts of models these days.
Yeah, for sure. So, like in a perfect world, right, health benefits would attract, retain, and reward people. It'd be affordable. It'd satisfy the ACA rules. It'd be a benefit for every employee. But, the truth of it is that group health insurance has ridiculously high premiums. The deductibles get higher every year. The coinsurance gets higher every year. It's such an awkward conversation every single year. Oh my God, they didn't give you 11 months to breathe, and they're coming back with another, monster increase. You have to change something. And employees aren't stupid. They get it. They see. They're not going, oh wow, I'm so excited about my $6,000 deductible. They're not. They're not going home to their wives and going, look, honey, look how good the benefits are.
That's what's making them not go to the doctor too. I mean, it's a benefit, but they have to still pay for it.
Barrier to health. And so they're going to be more sick days. They're going to be tending to look at other employers who have other offerings that are better. It has no impact on health. And 85% of your employees, by definition, it's about 85%. We see it fluctuate from group to group, are disenfranchised. They don't see the benefit. And so you're paying for 15% of your sick people, and 85% think it's crap. Show me one other thing. It'd be like, asking all your employees, what do you want us to serve at the company annual Christmas party for food? It's either barbecue or liver and onions,
No, that might be an even smaller percentage than 15.
Maybe. So look, when we switch to an ICHRA strategy, some really magical things happen. And our strategy, I'll just say right out of the gate, obviously it includes Next Level Prime, and I'll talk to you about why that is and how that all fits together. But what it comes up with for an employer is predictable, stable rates. I know next year what my rates are going to be this year. I can predict them. Instead of providing insurance for everybody, we only provide insurance for the people who need insurance, the ones that are sick enough to need it. And we can pay for that with pre-tax dollars using the ICHRA. There's all this craziness around employee health risk. I don't know what genius along the way figured out how to get employers to accept employee health risk it's like on my balance sheet. It's not there, but it's really there. And then I got to go buy insurance to pay for it. that was a sheer stroke of genius by somebody over at Blue Cross that came up with that plan, and then said, oh, and we'll just pay for it, whatever they get, it doesn't matter. And then we'll mark it up and give it back to the employer, and they'll pay the bills plus our profit. Man, brilliant move, Blue Cross. Just brilliant. Love it. But ICHRA came along, and ICHRA says we don't have to do that anymore. But we can still satisfy the Affordable Care Act using ICHRA, because those people that need insurance get insurance. We can increase employee satisfaction by plugging in something like Next Level Prime. And instead of bolting Next Level Prime on top of your group health insurance plan and paying for it with after-tax dollars, we can use pre-tax dollars to pay for Next Level Prime, and we give it to every employee because ERISA says we have to. Great, because guess what every employee needs? Primary, preventative, urgent, chronic care. They all need it. All need it, and their wives need it, and their kids need it. When I make the wives and the kids happy, guess who's happy and shows up to work? My employee. And so it's just magical. It's a true benefit. So ICHRA gives us the freedom to structure this plan, and then we meet like the 401k advisor. We meet with every single employee, and we ask them, "How's your health? Are you on any medications? How can we seat you, put you in the best possible situation for you?" Remember, this is an individual sport, this whole healthcare thing. Next Level Prime makes it individual. Membership makes it individual. ICHRA makes it individual. So if they need that insurance, they get the insurance. The other people, we use a cost-sharing model for the catastrophic risk because it's better placed in a sharing environment, non-faith-based, of course. And so this whole No Surprises Act is just sort of like the final nail in the coffin. What came out as a push for price transparency is turning out to be a knife in the back for employers, because now employees have the evidence they need to sue the group health insurance plan. You're paying how much for that medication? Yeah. Well, that's what Johnson & Johnson got sued over, and they'll lose. And other employers will lose, and sooner or later, more and more people will go, "Oh, what do we do differently? Call Art over at Scoop Health." Yeah, so that's why ICHRA.
So, but yeah, I mean, you're basically giving each individual the choice of how much or little, not coverage, I guess, but help that they're going to need with their healthcare costs, and giving them a way to access care in a way that isn't so expensive. So I love it.
Yeah, it's individualized, and yes, everybody gets their own choices. Whether if they don't want the cost sharing and they want the insurance, they're going to get an employer contribution, just like they get an employer contribution towards a group policy. And the exchange plans, they look exactly like employer plans. They're Blue Cross, Aetna. They're all of the main providers are in there. In fact, ironically, I just got a letter from Blue. I used to have my license as an insurance broker because I wanted to see how it worked. And I got a letter from Blue Cross a couple of days ago, an email that said they're encouraging me as a broker to show my clients ICHRA before the competition does.
Okay. Good.
Okay, Blue
they're
Cross.
On board.
Thanks. Anyway, so go ahead. I'm sorry.
No, I was just going to say, with all of that, what kind of businesses are really best suited to kind of move toward an ICHRA structure?
Yeah, I'll say the ones that are the most likely. It's a state of mind. I think it takes a state of mind. It takes an employer that's just had it up to here. I'm so sick of group health insurance. I'm so sick of the expense. This next renewal. But unfortunately, it seems to have to wait for them to be softened up before they're ready to come around open-minded enough to consider that there might be something better. We're starting to see more employers who have no other employers who've done this that come around and go, "Oh, I saw my friend do that, and it doesn't look so bad. Maybe I'll try it too."
Yep.
So the kind of employers like my old mechanical contracting business, where I had skilled laborers that needed to show up. They got paid a decent wage, but they could take those skills anywhere. You know, we trained a guy to use some gauges and fix an air conditioner. He could leave with our customer list and go compete tomorrow. So we had to kind of one up the game. So employers who need to hang on to those employees, because that's what makes the wheels turn, brings the cash register, so to speak. Those are the employers that will benefit most from this, because their employees will be over the moon excited about the benefits. So hospitality, hotels and event operators, car dealers, equipment dealers, property management companies, facilities maintenance. I'm trying to think who else. Let me tell you about a manufacturing company, H&M.
Okay.
This is my poster child. Can I tell you about H&M, my poster child?
I would love to
What
hear
a
about
great
your
story. What a great story. H&M is a blue collar manufacturing. They chrome plate stuff, big stuff, huge stuff, like 40-foot long mud screws and big giant wheel hubs that are taller than me. And they dip them in these big vats of ugly chemicals and electrify it and metal sticks. And it's unbelievable. And they've got 160 employees. Most of them are Hispanic. A lot of them don't speak English, but they get paid pretty well. And man, when one of them doesn't show up for work, the whole damn stuff, everything stops, because he's in the process, right? And without him, the polishing guy or this guy, the product doesn't ship. And so I knew the guys that were buying the company. I'd known the owner for a long time. I kept trying to tell him about ICHRA. He's an old guy. That's what happens, is the state of mind thing, right? They get stuck on the idea that group health insurance is the gold standard and nothing else is going to cut it. In fact, I'm a bad employer if I do anything but offer group health insurance, right? We convince ourselves of that. And I did. I fell for that hook, line, and sinker. And so we finally, the company sold, and I knew the buyer, and he committed to me that we were going to do this right after closing, and we did, and it's been a year. The company saved, so they paid 6 times earnings for the company, 5.5 times earnings, and we saved by moving from United Health Insurance with a $6,000 deductible to this ICHRA strategy, including Next Level Prime. The company saved $250,000, $250,000. Now, you just do the simple math, times 5.5. That is an increase in the value of the business from the day they bought it, just because we changed the benefit strategy. But that's not the good part. That's not the good part at all. Every employee is saving at least $1,000 a year on healthcare because of Next Level Prime. And we bake in some first dollar reimbursements for every employee for maybe they want to go to a specialist that's not Next Level Prime. We'll give them some money for that. We'll give them some money for some wellness programs or maybe a gym membership. We'll put some money in for that. ICHRA gives us the flexibility to create a strategy. We can bolt on an HSA if we want to. There's a number of strategies that we can do. All it is to say, the employees at H&M are over the moon happy. Once Next Level showed up on site the day of enrollment with us, because we're hand-holding everybody, and you guys show up and hand-hold with us. And then everybody wraps their arms around these employees and treats them like they matter. And all of a sudden, they start feeling cared about again.
That's
instead of this $6,000 deductible shoved at them, and here you go, have your group health. No, but let me tell you what. In the beginning, oh God, everybody was super apprehensive and nervous, and like, oh God, what if we harm one of the employees? I'm like, you're already harming all of them, you know. So anyway. That was H&M was a great success story. They're having success in hiring. Their retention is up. We get all the time, I get calls from, oh, can you talk to this new employee that we're interviewing? Can you run them through the benefits? They've pulled other people from the competitors who are still offering that $5,000 or $6,000, thinking that they got the cat's pajamas, and H&M shows up with this new thing. And other employees are bringing in their friends now as new hires and stuff like that. So it's been incredibly good for the company. Yeah, incredibly good.
So is it required or best or not required for a company, if they're wanting to make this change to an ICHRA plan, do they need to wait for an open enrollment period?
Well, don't call me during open enrollment because I won't talk to you. No, it's not. You don't, because that's the kind of one of the nice things about ICHRA is it does allow us to do a special enrollment. Yes, it does mean that we put the employees through a second enrollment in 1 year, but next year's enrollment is breezy easy because we're not changing anything. Next year, we just tell the employees, oh, maybe we lower the IUA on the sharing plan from 2,500 to 1,000 because we save so much money, which H&M has done. They've spent some of the money that they saved, that $250,000, and put it into an HSA. So they give every employee a $500 HSA type of setup, and it's just ways to incrementally increase. But all that is to say, renewals are easy. And no, I don't want to compete with a group health insurance exercise because there's so much going on during a group health insurance renewal. I mean, all the goings and comings of we're telling them, where are we going to tell employees to go get care so we can constrain the cost, right? How are we going to restrict? What are we going to pay for? What are we not going to pay for? These conversations have to happen every year. I don't want to get all mucked up in that, having an ICHRA conversation. So I tell people, if you're within them, if an open enrollment window is open, let's talk the day after. And let's take a look at what you did and then plan it out. And we'll figure out maybe 3, 6, or 9 months down the road, we'll do the migration over to ICHRA if it makes sense. But you have to look in order to know if it's going to make sense.
Interesting. So we talked also about what kinds of businesses. What about size? Is there a sweet spot when it comes to a size of a company or an organization?
I suppose after you get past the attitude part, where as long as the owner or the leadership team is at least committed enough to open the door and look, once we get past that, size does matter for a couple things. One is groups that are moving from never having anything to having something. It is hard. It's tough. I mean, we're working with a couple of schools right now, and it's pulling teeth. They have to go back to their board. They have to get more money, and it's a terrible thing. We can help, but it is. Somebody has to really show up and want to solve this problem. Anybody that hits the ACA mandates, and by the way, 45 is where they're going to start looking, because those are the people that are trying to duck ACA requirements, and so that's the likely target for them to start poking around is under 50, not over 50. If you've already said I'm a large employer, then no harm, no foul. But those in the range of 50 that have already swallowed the pill and they're spending the money, they're the most in danger. But we've gone as high as 1,100 is our largest group. There's no reason other than the headaches and timelines of doing enrollment to make it there's no particular number. It really comes down more to the nature of the employees. If you've got like a super high turnover business, like if you're just churning and burning, like, revolving door in the hiring suite, this might not be the best solution. But if you have a stable workforce, even if you're a restaurant, they said in the article, restaurants aren't good. What they should have said is if you're like a really well-established restaurant, like if you're the Pappas, then you have a stable group of managers and assistant managers and wait staff that show up. In fact, those permanent part-timers, this works for them too. We can give them something as well and still use those pre-tax dollars to pay for it. So it comes down to the nature of your workforce. If you really count on them and they have special knowledge to do their jobs, then ICHRA is going to be a good solution for that.
Keeping that retention for sure. So, I mean, this all sounds like almost a little too good to be true. Why, you mentioned 2020, this has been around for several years now. Why are more businesses not jumping on board?
Oh, sure, Dr. Rakers, twist the knife. You're going to have to stitch me up after all that.
Let's hear it. Let's hear it.
No, it's a great question because people ask me all the time, well, if it's been around for so long, how come? Well, first of all, we had a pandemic 3 months after it came out. Second of all, we have insurance agents who have the attention of every employer, and with good reason. They've earned that trust.
Yeah.
And I'm coming along and saying, whoa, all good and well, trust your broker, get the best rate you can get out of your broker, but now we have to compare it to an electric vehicle, the ICHRA. And so there's been some reluctance on the part of people to believe that there's something better, that there's something that could actually work better and differently and so differently. I mean, look at Next Level Prime. How hard has it been to convince employers that membership-based primary care is the freaking bomb? It's going to win over so many hearts and minds with employees. When they're getting their broken legs set at Next Level Prime, they're going to be thanking their employer because it was free. It's so magical to see these things all come together in this way. But just like it's taken Next Level Prime a long time to get that knowledge and that awareness, ICHRA's like a few years behind, kind of playing catch up. That people are starting to come around and realize they gave us the federal government gave us a new thing, like they gave us 401k. You can drive right by that and keep offering pension funds. But you're not going to be able to hire people if you don't provide great benefits. And so, I think I'm one evangelist of maybe a handful of people that are really preaching about ICHRA in the entire country. I don't think there's too many people that took the time to understand how this works, because I came at it from the perspective of an employer who's felt the pain. I've been a provider and I've watched employees come in and live through the pain of getting denied. My God, you trust the insurance, all of a sudden you're getting denied. So I mean, I feel a really emotional connection to this whole solution set, to ICHRA, to helping employers solve this problem once and for all. Because once we do ICHRA, nobody goes back to group health insurance ever. We've never had a group leave and go back.
So I think what you're kind of getting at essentially yes, we've seen it too on Next Level Prime. I think anything that employers are, presented with that's outside the box a little bit from that group health, insurance way, which has been the way for a very long time.
Really long
It's
time.
very hard to get them to, make the jump to try something different. But I think recently, because of that steep, rise in the rate of, cost of premiums and plans, people are finally starting to say, well, we have to try something different, right? So let's look at
so when that happens, you have two choices, right? You can sit down with your insurance broker and you can figure out ways to constrain care, to steer employees' consumption patterns, to direct them to limited choices so that you can constrain costs. But I don't know how that doesn't end in a lawsuit someday when an employee gets hurt or something happens or they just don't like it. Right? I just don't like the choices that you're spending our employee health plan dollars on, boss. So sorry, but I got a lawyer. It's not going to happen to small employers first. It's going to happen to the big ones. But why wait? Why wait? Why continue to stick employees with this crummy group health insurance alternative when you have something else that you can do for them that's so much better? That's all I want to do, is have that conversation and show people that this is a better thing. It's at least a 50-50 option, right? It's way better than that.
What do you see, or hear are the biggest concerns from employers that are maybe thinking about making this switch? What's preventing them from doing it?
Fear. I think there's a lot of disbelief because of the pre-programming, but there's a lot of fear around it's like the Chicken Little thing, right? They make up some wild example of, some situation that could maybe happen. And then we try and attack that as the straw man for the whole solution set. But that doesn't really hold much water.
There's risk in everything,
it's definitely real.
Yeah. I mean, there's risk. No matter which way you pick, there's going to be risk involved in healthcare because you never know what's going to happen. But I think you've mitigated with your options. You're mitigating risk. You're mitigating risk with group health.
Exactly. And so I think that, this whole notion of getting out of the group business, stop being in a business that you have nothing to do with. My rock climbing gym over here, we don't do insurance, but we had to buy insurance. And so all of a sudden I'm in the insurance business. And so that, of course, we have to trust these insurance brokers. And I know I have a lot of friends that are insurance brokers, but they get paid when they sell insurance. And that's fine. If insurance is the solution, great. But if you want to drive an electric car or consider an electric car like an ICHRA, then this is maybe something that bears a separate, perspective on, and an open mind without all the skepticism in the way. And those are the employers, those are the people that get this, that are so happy with it, like H&M. Man, they're over the moon about how well it works for them. They saved a ton of money. The employees are happy. The employer doesn't have to deal with an insurance renewal next year. Oh my gosh. Yeah. It's a dream
Let
come
me ask
true.
this, just because I think maybe this could potentially be a concern. When people switch to this kind of plan, the employees are not going to get that health insurance card that says Blue Cross Blue Shield or some other carrier, right? It's just different, right? So
It is.
I don't know if that's a concern that you hear coming back to you. How do you kind of talk about that
So,
with the
so I look at this picture as a couple things. First of all, there's the everyday risk that we put into the next level basket in those first dollar reimbursements. And then there's the catastrophic piece, which is usually about 15% of the population has something ongoing, and we get them insurance for that. So they do have that insurance card.
Okay.
All the rest of them, we put them on the cost sharing thing, and we educate the heck out of them. We spend an awful lot of time. We tell them before enrollment. We tell them during enrollment. We give it to them digitally. We give it to them in paper. We give them phone numbers. We text it to them. We come back after enrollment the first week, then the first month, and then the first quarter. And guess who's following us behind? Is you. Next Level comes in behind us and does the flu shots and offers them the contest for the physicals to win a Blackstone grill if you come get your physical. So these employees are. And what I find is that they never ever focus on it until they need it. And the minute they need it, if we're there and we give them access to someone to talk to, a phone number, and we put it in their protocols at Next Level. So when they go to Next Level, because we tell them, go to Next Level for everything first, it says in the protocols, this member is a medical cost sharing member, or this member has Blue Cross, or whatever. And then so the provider knows how to counsel that person, to send them to a surgeon that we know accepts cash. Of course, they all accept cash, but some more willingly than others, more open about it than others. And that's a whole other subject matter, right? But all that is to say that if we know them as individuals and we provide them with the support they need when they need it, because nobody cares until they need it. And that's why Next Level is so good, is because Next Level is right there in their face, always. They know Next Level. They know it. They can go there first. And if they need catastrophic anything, Next Level knows, either send them back to Scoop, send them here, we know, because it's in their protocols. And so they feel very taken care of. They don't have to sweat the whole being an individual consumer, just trying to navigate the rivers of healthcare on their own. They don't feel that way anymore.
Yeah.
So when they get over the whole no card thing, they do.
Yeah, I hear you. That's I'm glad we're here to help navigate your people as well. So that's a great story.
It really is. It feels good when you go to Next Level. I've never ever had anybody come back and say, "Gosh, I had a mediocre or terrible experience at Next Level." It doesn't happen. Never, ever. It's an amazing service. I'm super proud of you and Dr. Breeze and everything you guys have done over there. It just seems to keep getting better. And we're working behind the scenes, navigating for employers and groups with Next Level and our other services. And always Next Level gets everything done perfectly, both behind the scenes and interacting with employees in such a great way that they reflect so well back on an employer. It's really magical.
Well, thank you. We certainly love to hear that. We definitely try. So
it's working.
You're talking about all the great things. I think I'd love to close with just hearing about maybe one of your best kind of success stories with ICHRA.
Gosh, I'm going to tell an employee story.
Okay.
And it's an employee at the Texas Rock Gym.
Okay.
Her name is Kaylin, and I saw Kaylin walk in one day on one crutch. And I said, Kaylin, what's up? She goes, water skiing accident over the weekend. And so why don't you go get it taken care of? She goes, well, I need a new battery for my car. I said, well, Kaylin, it's Next Level Prime. I'm paying for it. She goes, no, it costs money. So no, that was the old Next Level. This is the new Next Level. This is our membership. So she went and she had a consultation with an orthoped through you guys, no cost. It turned out her leg was broken. She got a brand new boot, a new pair of crutches, and a smile. I saw her a couple days later. She was smiling, and it's like, Kaylin, what up? I love the new crutches. They're great, And she said, I never knew how to consume healthcare before because I've always been on my parents. And they always did everything for me. And man, as an employer, I was busted with pride, right? Not only did this employee get the care she needed, it was a broken leg that she was willing to hobble around on one crutch because she needed transportation more than she needed health care. What a horrible thing as an employer to have that decision being going on. Like you said earlier, they're avoiding health care because it's intimidating and it's expensive. And I just can't, right? That's how she felt. And so this is such a gift to her, and it made me look great as the employer. I love the employee. She's a great gal, and just so many positives out of that experience. And that's magnified every day at every Next Level center, everywhere in Houston. I know that same experience is happening 1,000 times a day. It's super powerful, and we love giving that gift to employers and their people. I've never once been embarrassed by Next Level. I'm super excited to bring them to the table on every solution, every ICHRA strategy that we do. In fact, we'll go outside of Houston to do ICHRA strategies for other employers. We have employers all over the place, and we'll use a more traditional membership-based direct primary care doctor that doesn't have all the bells and whistles and the labs and the urgent care functions that Next Level provides. And so many other things. I could list them all, but you already did in the beginning. They're all there. We just don't like going there anymore. We try and follow Next Level around because there's so many employers right here that need this. Yeah. And, it works great with a direct primary care, but it works like rocket fuel with Next Level Prime in it. ICHRA.
I don't have anything more to say.
What do you add to that, right?
Thanks for ending on a very positive note and giving us some, kudos. We love to hear that. So, I think a great conversation. Art, thank you so much for joining me today. This was a terrific discussion. Thank you again to all of our listeners out there. And I guess we will see you all next time on Next Level Prime.
Thanks a lot.